Grauer. I am the second vice president of AFGE Local 3369. And with me today is congressional candidate for the 2nd Congressional District of New York, Edwin Osorio. Good morning, Edwin. How are you today?
Good morning. How are you? Good to hear from you, Todd.
Always good to speak to you, sir. As we know right now, a very hot topic issue is healthcare. And so I just want to jump into this and get started and get your take on healthcare. So Edwin, when you talk about healthcare as the foundation of every other freedom, you make it sound like a civic responsibility, not just a policy debate. What do you say to Americans who believe healthcare is a privilege, not a right?
Well, for starters, I'd say that you're wrong. And I understand that it's not in our Constitution. I understand that it was never mentioned in the Declaration of Independence. However, what was mentioned in the Declaration of Independence was life, liberty, and the pursuit of happiness. And it's very difficult to pursue happiness when you're concerned about your health, when you don't have access to good health care, and you're worried about going bankrupt because you can't pay your medical bills, and the impact that it has in so many families that in the aggregate it really harms the entire nation. um, I sort of liken it to The Republic by Plato. When Plato wrote, the basic idea of the book is that he compares the body politique to the human body, whereas for the body to work well, it has to work in harmony. And what that means is that your heart is in good shape, your lung is working with your heart, and your kidneys working with your brain, and all the organs are working in concert. And I think America has to do that also. But it's hard to do that when you're not healthy. It's really hard to do that when there are so many millions of people who struggle to pay for health care. And I also think that if healthcare is not a big issue in your life, well, then that's energy that you can devote to something else that makes you more productive.
Absolutely. I couldn't agree more. Um, you've also pointed out that the Affordable Care Act was actually born from conservative ideas, the Heritage Foundation and Governor Mitt Romney's plan in Massachusetts. Why do you think a plan that once united both parties became so politically divisive?
Well, it, well, first of all, I'm not sure that it really united both parties in the sense that while both parties really supported the idea, never simultaneously. It was a conservative idea. I think it came out in the 1990s from the Heritage Foundation. Mitt Romney in the early 2000 aughts implemented it in Massachusetts, where I believe it was really successful. And if truth be told, Obama adopted it because the 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 alternative was universal health care, and it didn't seem like we had much of an appetite for that. So a public option was what they were going for, and that didn't work out either. So the best next idea was the Affordable Care Act. But once Obama took it over, then Republicans distanced themselves from it, and they labeled it Obamacare, really as a pejorative. But the truth is that while conservatives rail against, even to this day, because we know about why the government shut down, and it had a lot to do with the Obamacare credits uh, disappearing at the end of the year, and Republicans would say that Obamacare or the Affordable Care Act, it didn't work because it didn't drive down costs. I don't know that it was designed to drive down costs. I'm not sure how you drive down costs when you remain private and you don't really do anything to actually curb costs. What it really did, and what it was really designed to do, was number one, to ensure that no American was denied of coverage because of a pre-existing condition. Can you imagine that you can't get coverage because you have cancer or that you have some other condition that the insurance company's not going to they're not going to provide you with coverage. That would be catastrophic. And the other thing was to make sure that more Americans had access to it. Prior to Obamacare, there were about 40 or 50 million Americans who did not have coverage. Remember, the only way to get coverage was either through work, or if you were receiving some sort of a benefit like SSI or public assistance where you qualify for Medicaid. But if you were right in the middle, where you had a job that didn't have insurance coverage, you couldn't afford it. And Obamacare made it affordable for you. So, but ultimately, I think we have to stop talking about whose idea it was. Is it a left idea? Is it a right idea? What should only matter is it a good idea or is it not a good idea? And what should make it a good idea is, do the benefits outweigh the cost for the American people? And that's all that should matter.
Couldn't agree more. You're absolutely right. Absolutely right. And now we're coming to a time again. We're going to come full circle again, where if these subsidies aren't renewed, that 40 million people that you were talking about might as well lose their health care again. So we know which direction that this healthcare talk is going. And
It's a shame. I mean, it's
absolutely,
hard enough for people just to make enough money to put food on the table, and to have to worry about your health care also. It's disgraceful, I think.
absolutely. Now, your plan to lower the Medicare eligibility age 1 year at a time is a gradual path toward universal coverage. How does this approach differ from Medicare for all? And why do you believe it's the most fiscally responsible and politically realistic way forward?
Well, I have to correct you first because I don't think it's universal, because universal would imply a single payer system. It would imply that it's all encompassing, and it isn't, because the whole idea of lowering a year every year is so that the private sector has the ability to compete and they can make adjustments in accordance to the market. So let's say, for example, somehow we got everybody to agree that we'll have a single payer system. Let's call it Medicare because we know how efficient it is. Well, first of all, how efficient is it? Well, Medicare has an administrative cost between 2 and 3%. You take private health insurance, whether it's Aetna or Cigna or Blue Cross Blue Shield, you're looking at administrative costs of 15 to 20%, which means less dollars are going towards actual Medicare and more dollars are going towards advertising and printing costs. And yes, to executive salaries. So it's not really effective. But let's say for some reason we went that way, okay? And everybody's on Medicare. That would be a big production to take a program that only insured 65 and older, which I don't have the exact numbers. Maybe it's 30, 40, 60 million. I don't know what that number is. Um, but all of a sudden, you're going to insure 300 million people. That's a big to do. And you're bound to have problems. Now, if you take the existing program, number one, you lower it a year every year. So, for example, next year, the eligibility age will be 64, and the following year will be 63, so on and so forth. It's incremental. It's easy to adjust, but at the same time, we're not taking the private sector out of the market. They have the ability to adjust. They can see what the going rates are. They can compete. Anytime there's competition, Americans will win. Anytime you have more than one group who's willing to provide health care and they know that they have to compete for your dollar, that's good for Americans. And I think with what I'm introducing, that's the way to go. It'll be very productive. It'll be efficient. And my hope is it'll be effective. And I think it will be. And the market will dictate everything to us. The market will tell us. And the market, of course, is driven by the American people.
Well, allow me to throw a wrench into this. I do want to ask the contributions into Medicare. from workers.
Uh-huh.
Will that be sustainable if we lowered the eligibility year by 1 year every year?
Well, obviously, you'd have to look for some revenue, uh, additional revenue. But think about it. When you go on Medicare, you don't get it for free. You have to pay into it. Like, for example, I am not paying into Medicare now because I don't receive it. But the day that I become eligible for Medicare, I would pay for it. I
Mhm.
would pay a monthly expense that I would be charged, and we'll have actuaries who are going to be much smarter than me that they'll make that determination to what the amount is. And once again, it has to be competitive, because if it isn't, someone else is going to come along and they're going to offer a good price, a better price. And
Right.
that's the way the market should work.
Absolutely. Absolutely. Now, you proposed linking federal subsidies and tax incentives to pharmaceutical innovation, rewarding companies that shorten their patents or share research breakthroughs for the public good. How does that strike the right balance between capitalism and compassion?
Well, compassion is to offer healthcare to everybody, and it's it's uh it's simply not compassionate to deny healthcare to somebody. I don't care what the reason is, but you have to be realistic. And realistically, we pay significantly more than any other nation that offers substantive healthcare.
Very true.
In fact, by some estimates, we pay double the next highest paying country per capita per person. So you have to ask yourself, why is that? Um, in a previous document addressing this that I'd written, I have it on my website. It's actually called Rolls Royce Healthcare for paying. We're paying for Rolls Royce Healthcare, but we're getting Cadillac results. And what that means is exactly what I just said: that we're paying double the next highest paying country, but the results that we're getting are inferior. We're not living as long. We're paying more for medication. All the measurements that tell you how healthy a country is. We have higher rates of diabetes. We have higher rates of obesity. So that just means that the money that we're investing, we're not getting bang for our dollar. So you have to look at ways to decrease the cost. And I don't think there's any doubt that one of the reasons is that we pay more than anywhere else in the world. We pay far more for our medications, for our pharmaceuticals. So we have to look at why we're paying more, and perhaps one of the reasons is that you have these big monopolies that they'll create a drug and then they'll have the patent for 20 years. Now, in most instances, I'd say that they're entitled to that patent because they invest a lot of money. Although sometimes the government has invested a lot of money, and we have to take a look at that as well. Because if the government invested a lot of money in the development of a drug, then maybe we shouldn't be paying as much. However, in instances where we didn't have much involvement in the investments, there are other ways to lower prices. For example, we can give tax incentives, tax breaks for companies that might reduce the amount of time that a medication is under a patent, or maybe even waive their patent, so that companies can come in with generics and make it less expensive. Or there are myriad ways that we can go about it. But the thing is, it all begins with people in legislation talking about it and trying to make determinations on what's best, and then crafting law around it, and then offering the support behind it.
Absolutely. Absolutely. Now, I'm glad you just brought up your analogy of Rolls Royce Healthcare and Cadillac results. Um, because under your plan, you said that America will finally pay Cadillac prices and get Rolls Royce healthcare. So that's the opposite. That's what we're looking
Sure,
for.
that's what we're
So,
looking
what
for.
does that mean in practical terms for families, for doctors, and for taxpayers?
Well, to put it simply, it just means that whether it's a part of our overall GDP or a part of a family household income, health insurance has to be a smaller percentage of the money that you earn, of your income. It has to be a smaller percentage. Right now, as a nation, I believe we're spending anywhere between 20 and 25% of our GDP, to at least 20% that goes to healthcare. That's too high.
Yeah.
Because and then after you factor in food and energy and clothing, there's not much left over for some of the things that we want to do to just enjoy the quality of life. So we have to look at ways of decreasing that. And I believe that many of my ideas, and I'm sure other people have other ideas, the idea is you have to have these talks. You have to talk to the other side. You have to talk amongst yourselves. And I mean, litigation's another thing. A lot of people would say that litigation drives up the cost. Maybe not as much as some people would say, but 2 or 3, 4%, but everything adds up. So maybe we need laws to cap the amount of money that somebody can sue in court, or maybe we have to create other avenues so that maybe a medical board will review something that might turn into a lawsuit before it ever turns into a lawsuit and winds up in the court, and then you're spending hundreds of thousands of dollars paying for attorneys, and then you have damages that sometimes run into millions. So there are a whole host of things that if you look at it piecemeal and then you aggregate it, it can result in lower costs, but without degrading service.
Very good. Very good. Let me ask you, Edwin. I think you've covered a lot. You've given us a lot of information. Is there anything that I should have asked that I didn't that you wanted to go over?
Well, I think we covered it all. I guess the only thing I would say, and this ties into our last podcast, this being podcast number 3, and obviously the last podcast, podcast number 2, we discussed AI, and while AI has the ability to remove jobs, and we have to be mindful, healthcare is one of those areas where it can not only do a substantial amount of work, but it can actually relieve doctors and technicians from the tedium of going through records and looking through results and a whole host of things that require intense research. And you can give it to AI, and if you're a doctor and if you're not writing your own reports because you can get AI to do it, that's more time that you have to serve actual patients. You see, one of the problems that we have is not that the system is broken and that's why I have to wait so long to see my doctor. We don't have enough primary care doctors. When you become a doctor, the first thing you realize is now you're in the hole for $250,000 to $500,000 in tuition to your medical school, and in the first few years you're not going to make a whole lot of money. You're doing your residency, so your first inclination may not be to be a primary care doctor. You want to be a specialist so you can make serious money.
Right.
We need to create incentives to have more primary care physicians,
Hmm.
whether it's student loan forgiveness or other programs or tax credits. We need to have more nurse practitioners who are practically doctors in almost every sense. Maybe we need to encourage more of these positions to be filled so we can backlog all the doctors that we're missing. So once again, there are myriad things to do, and we can accomplish it all by having a will to just move forward and not make it personal, not make it partisan, and just be laser focused on results. And it doesn't matter where the ideas come from.
I
Good
agree.
idea.
I think once we remove the partisanship,
Yeah.
we can definitely make some headway. I really agree with that.
Well, that's my goal as a union leader, as a union president. I've negotiated, and I'm accustomed to working with the other side as opposed to working against the other side, and I'm hoping to bring that to Congress.
I've actually seen that in practice, so I'm hoping as well that you can bring that into Congress too. Edwin, thank you for joining me again. I look forward to our next conversation. But in the meantime, I just want everyone to remember 2nd Congressional District of New York. Edwin Osorio, candidate for that congressional seat, November 2026. So thank you again, Edwin. And I look forward to our next conversation.
Thank you, Todd, and have a great day. Take care. Thank you.
Take
Bye.
care.